Hi, my name's Phil. I like talking about politics, and in this video I'm going to take a look ahead at the likely atrocities that Boris Johnson's government are going to commit in order to avoid taking the right steps to get on top of the COVID pandemic by taking a little look at what he did during the first wave. The concept of simply denying elderly patients intensive care in hospitals has surfaced again in the media, and it is, I believe, a foreshadowing of what is to come. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, where we are at the moment with the COVID second wave is that it is, of course, now completely out of control. Our test and trace program cannot cope. Frankly, it wasn't coping over summer. That was a bad sign. It was not coping over summer when the pandemic was at a very low ebb and was never going to have any chance when schools opened last month without some extra measures. The government's own scientific advisors warned them about this. They said, in order to open schools safely, you are going to need to do this or this or this. You know, they didn't. They ignored that completely. So now the only thing left to do is to lock down again. Remember, a lockdown is required when your test and trace cannot cope. You do it to bring the R value back down, bring the rate of infection back down to the point where the test and trace can cope. But the government are refusing to do this, of course. We know from the first wave across the world that countries who delay the right measures suffer more in the end. So the government is giving the impression that they are simply not going to lock down. Even their so-called Tier 3 restrictions covering a large proportion of the country is not a lockdown. You're not even prevented from going to the pub. It's hard to imagine. Pretty much, as far as I can tell, you can't go to the gym and you can't go to a betting shop. The gym is the only one that's really a bind for anyone, as far as I can tell, because you can bet online. You as long as you're having a meal, you can even go to the pub. So that's not going to be of any use at all. So what is it that will force the government into action eventually? Because they can't just not go into lockdown. It's not actually a choice. You know, even if it's too late, that decision will have to be made. And the thing that will trigger it is our healthcare system collapsing. When hospitals are full and turning people away, that's when a lockdown is no longer the most damaging political course of action. The same was true of spring as well. The Conservatives are so incredibly desperate to hide their 10-year raid of the NHS that they needed it to appear to be coping. Absolutely imperative. A lot of people have voted for the Conservatives, bafflingly, because they believe them when they say they preserve the NHS, they fund the NHS, they believe in the NHS. The government cannot allow that lie to be exposed. Of all their lies, they cannot allow that one to be exposed. So what they did to this end is they discharged elderly COVID sufferers into care homes. We know about this where of course the infection then ran rampant in places that should have been shielded, and an extra 20,000 people died as a result of that one policy, just that one policy. But that was all right for the government because then they could blame the care homes. Well, the deaths occurred in care homes, the infection spread occurred in care homes, so that's their fault, not ours. In addition, if they hadn't have done that, hospitals would have been overwhelmed and everyone would have seen just how much damage that the government have done to the NHS. You know, and a lot of these people would not vote Conservative again. But another abuse, which was reported at the time, I talked about it myself at the time, but it's been brought up again in the Sunday Times yesterday, because now we've seen the effect of this. And it's the idea of simply denying life-saving treatment to elderly patients. Now, at the time, government guidelines called for a form of triage in terms of allocating intensive care treatment that focused on where it would be most likely to succeed, which is, of course, how triage works. You know, when you've got limited resources and you have to apportion them, you have to make those judgments. Who is most likely to respond to it? And elderly patients, especially those with some underlying health conditions, are much less likely to respond to intensive care than someone younger and fitter, of course. But the problem here, of course, is not that this triage had to be done. It's that we should have had greater capacity. We should have had more intensive care units, more intensive care provision. Decisions like this should not have become as commonplace. The bottom line was that elderly patients are mostly going to be the ones in need of intensive care, and they were simply denied it. The Times ran a chart, very illuminating chart, which shows the situation starkly. So the yellow bars are those who received intensive care, and the teal bars are for hospital deaths. And it's obvious, really, the vast majority of patients who are going to need the intensive care would have been the elderly, the ones who are less likely to respond to pre-intensive care treatments. And yet these represented the age group that received it the least. And of course, a lot of those patients wouldn't have made it even with intensive care, but others would have done. Like I said, we need to remember what has caused this situation. One, the government failed to act according to medical and scientific advice from the get-go. This created the environment whereby hospitals were flooded with COVID sufferers. We had many more people being infected with COVID and needing hospital treatment than should have been the case. So we created extra demand. Then, secondly, on the supply front, that same government that's gutted the NHS over the last decade to the point where it doesn't even have the capacity to cope in a normal winter. Last winter, COVID, it may have been in the country, but it hadn't hit. We didn't know about it. And we were still on our arse last winter. It cannot possibly cope with a serious pandemic like this on top of the usual winter pressures. Germany, for example, managed the situation much better, directly as a result of the fact that, not only did it make the right decisions based on scientific advice, but its healthcare system has a lot of extra capacity built in for intensive care. They have a lot of intensive care provision. They don't just design their system for normal use, they design it for when there's a serious healthcare crisis. Remember also that our government were expecting a viral pandemic. Some people will say, this is like a once in a century thing. I mean, we do not know that. But even if you say, there hasn't been something this serious for a century, and you might then imagine, the government wouldn't have expected it. They were expecting it. They were expecting it. We know that. But although Germany is pretty impressive, there are other comparable, because it's like saying, you're just pointing out the best one. There are all other comparable European nations are still better than us in terms of intensive care provision. Our intensive care capacity is frankly pathetic. We simply did not and do not have the provision to deal with this pandemic. We are also not even in a stronger position now than we were at the start, all things considered in terms of what is coming. Treatments have advanced. That's our best hope. That's the only plus, really. But with a second wave producing more cases than the first, and seasonal flu to consider, as well as other winter pressures, that is really not likely to compensate. The government will still not publish the report they had commissioned, Operation Cygnus, a few years ago, specifically for this eventuality, because like I said, they were expecting it. And the reason they won't publish that report, according to those who've seen it, is because it will highlight just how defenceless they left us. But this is what happened in spring. Why it is so relevant now is that winter is coming. We are already well into our second wave. Hospitals in some of the more neglected parts of the country are already filling up. The government are refusing to lock down again. Even their regional restrictions are pathetic. And we know that it's not doing anything to suppress the rate of transmission at all. Public trust in the government, of course, has also been shattered, which further renders their efforts even more impotent. The scientific and medical consensus is that we are buggered. We are headed for an extreme winter healthcare crisis. Johnson will be looking at ways of again putting smoke and mirrors in place to make it appear that the NHS will once again cope. It can't. It can't cope any better in winter than it did in spring. In fact, it'll be much more difficult to do so. Reports are already talking about a shortfall of £1 billion in the NHS in order to cope this winter. £1 billion. A drop in the ocean compared to the billions wasted by the government in lining the pockets of friends and donors. £1 billion shortfall. Consider this. They spent more than half of that on paying for middle class people to eat out in restaurants. That's the shortfall. You know, and although it's a relatively small amount of the government's pandemic spending, it is a large hole in the NHS's winter capacity. So Johnson's going to use the same dreadful tricks he used before. This will include denying treatment to elderly patients again. It has to. There is no other way, given the complete failure of his COVID strategy. The Times also noted that as the first wave subsided, the government announced, this is a quote, "Throughout this crisis, we have protected the NHS, ensuring that everybody who needed care was able to get that care." That is completely untrue. Large numbers of people were denied care that they would have received if we'd have had the greater capacity to deliver it. It was a lie. If we'd have had, and some people may say, oh, well, you know, it was such a large amount, we couldn't have possibly had the capacity for everyone. We'll put it this way. If we had the same capacity as comparable nations, many more people would not have been denied that treatment. That's all we needed, the same capacity as other nations. It was a lie, a complete lie, designed to fool the proportion of the population who didn't know better. Now, obviously, if you had an elderly friend, colleague or relative that didn't receive the care because of this, then you won't be falling for that lie. You will know that they did not receive care. But many may not have known someone in that position. And so, you know, the lies may work on them. Obviously, by pulling the same con again this winter, there'll be a whole host of new groups who may have fallen for it in spring, who will now be introduced to the lie this winter. So the number who will fall for it are very likely to diminish still further. But that will be little succour, I suppose, for those whose loved ones who survived the first wave, only to be sacrificed to the second. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.